Immediate postpartum care for the mother and newborn. As an introduction, the immediate postpartum care ensures the well-being of both the birthing person and the newborn baby. We manage the physiological changes and prevent complications. Midwives and the birth team provide monitoring support and interventions when warranted. We combined our clinical and our emotional support combinations in a medical and holistic postpartum care experience. Immediate postpartum care. We watch for complications. We're checking for postpartum hemorrhage, that the uterus is getting soft, uterine atony, infection, and shock. We'll be taking regular vital signs, usually every 15 minutes apart, the first hour. We'll be assessing the uterus to make sure it's nice and firm and preventing complications. Excessive bleeding is managed with massage, medication, and getting to the root cause of the problem, which is typically managed by the midwife, but a birth assistant and the care team also needs to be able to support the midwife during those complications. Monitoring and managing the placenta, the midwife ensures that the full expulsion and complete removal of the placenta has occurred so that there's no bleeding and infection risk. Retained fragments may require manual removal and/or hospital care. Emotional support and maternal well-being. Midwives and the birth team offer emotional support during the immediate postpartum transition. They encourage bonding, skin to skin, reassurance, helping to assess for any anxiety and depression, especially that golden hour. They may do some referrals postpartum if the person has a history of trouble with breastfeeding. The IBCLC may get involved if they have a history of anxiety and depression. They're going to make sure mental health support is involved. If they have a history of postpartum hemorrhages, they're going to be watched a little closer for those. Pain management and comfort. Midwives tend to prefer more natural pain relief, and we can provide Motrin, Tylenol if needed, but a lot of times it's ice packs, it's rest, it's gentle support. We'll review a lot with them in the postpartum period about perineal care, sitz baths, and there's some lidocaine sprays and herbal sitz baths that are great that moms can be educated. Breastfeeding initiation is really important to do as soon as you can after delivery. It helps with the bleeding. It helps to get that large amount of colostrum in the baby. The golden hour is so valuable for mom and baby. So the midwife and the birth team really encourage skin to skin, getting the baby to nurse as soon as the mom and baby are ready. Monitoring for postpartum depression. So it's not so much of an immediate postpartum assessment, but this is something to watch for people that have risk factors and educate the support team for postpartum evaluation to catch those early signs so that it doesn't become severe anxiety and depression. Immediate postpartum care for newborn. You want to make sure the midwife will traditionally do the initial newborn assessment, but birth assistants and more skilled nursing team can help with that. But even as a birth assistant, you're still going to make sure this baby looks concerning. I want the midwife to check the baby out. The chest should be pink, there should be good muscle tone, the baby should be alert, the baby should be breastfeeding well. There's certain things to make sure a baby looks okay. If they're blue, they're not breathing well, they're grunting, they're breathing fast, they don't have good muscle tone, getting the midwife right away to do a further evaluation. We do an APGAR score at 1 minute and 5 minutes to show how baby's adjusting to transitioning to life. There's the breathing, the heart rate, the muscle tone, the alertness. And then if you have a significant newborn resuscitation, they'll also do a 10-minute APGAR score. APGAR scoring is color, pulse, reflexes, tone, respiration. They're either getting 0, 1, or 2. So you can get a 0 out of 10 or you can get a 10 out of 10. It doesn't so much help to determine what you're going to be doing for resuscitation. It more helps to see if the resuscitation efforts you're doing are helpful or not. So if a baby is a low APGAR score, you would be anticipating you should be doing some newborn resuscitation measures versus you have a high APGAR score, the baby doesn't need help in the transition. So you're determining that the baby's got good heart rate, has good muscle tone. You're determining that this baby doesn't need a little assistance transitioning. Cord clamping and cutting. Usually the midwife does this. Usually it's delayed cord clamping, but if there is a concern with mom and baby, it will be cut right away. I know midwives are much better in home and birth center setting to keep the cord intact for newborn resuscitation, but in the hospital with the newborn warmers and the setup, most hospitals will cut the cord at a minute or sooner if they need to help resuscitate the baby. If you're doing delayed cord clamping, it's usually 3 to 5 minutes on average or until it's done pulse. Breastfeeding and bonding, getting early skin to skin, great breastfeeding aids in the temperature, the heart rate, and the glucose regulation for the baby. The midwives and their assistants and team can help with breastfeeding and getting a good latch. A lot of times, if you're just patient and instinctual breastfeeding, the mom and baby will be able to together on their own. A physical exam and a screening, the midwife and their team will look for abnormalities, defects, and problems with breathing. The assessment that the midwife traditionally does is a head to toe assessment, looking for jaundice is pretty rare immediately after delivery, but at the future assessments, especially day 1, there is pathological jaundice versus physiological jaundice that tends to come on day 3 to 5. So there's certain things the midwife is looking for. Your role as a birth team and birth assistant is to catch those major concerning signs with the baby breathing too fast, not breathing well, having a chest that's blue, not good muscle tone. That's when you get the midwife involved. Temperature regulation, you want the room to be nice and warm. You don't want it to be cold. The baby will be skin to skin with the mother. You want warm blankets. You want warm towels, especially with a water birth. You want to prevent hyperthermia, the mom to shake too much, and the baby to get too cold and calories. The vitamin K and eye prophylactics, some of them are done the first 10-20 minutes and some are the first 45 minutes done. There is a time parameter to get both of those done if the parents want them. Usually the midwife does it, but as you become a more experienced birth assistant, a midwife student, part of the birth team, that may be a delegated responsibility. Newborn identification and safety. This is more of a thing with hospital settings, but home and birth center, because they're a small personalized setting, there's not multiple babies that they have to worry about them getting mixed together. So with hospitals, it's definitely an important thing to put proper identification so the kiddos don't get mixed up. Umbilical cord care is not usually a big deal immediate postpartum, but definitely depending on if they use a rubber band or a traditional cord clamp, that usually has to dry 24 hours to get that cord clamp removed, and giving the mom good education of what to watch for signs of infection and when to get additional support. On postpartum education, I think the midwives and birth assistants and doulas and lactations, we all have equal responsibilities to educate the mom and the family about newborn care, especially when they're doing home and birth center deliveries. If you have a home delivery, you're there for up to 2 hours. If you have a birth center delivery, they're at the birth center for up to 4 to 6 hours, and they have to be the expert in the baby until you come and do the 24, 48-hour home visit. In the hospital setting, they just hit the call light if they have a question or concern, and they have people down the hallway and checking on them all the time. And so you have to be really well educated when people are choosing out of hospital births, because they have to have a lot more autonomy of what to watch for is normal and not normal. And with the mom and the bleeding and signs of infection and the milk coming in and exercise, nutrition, and follow up. Transport considerations and emergency response. In that immediate postpartum period, the midwives and the birth team are going to assess the mom for bleeding and the baby for issues with transition. Those are the big things in that first hour to really keep a close eye on. And with breathing on a baby, minutes matters. And with bleeding on a mom, minutes matters. So you have to be really strong as a midwife and birth team to be able to handle those things in that immediate postpartum period. Because sometimes it can be quite overwhelming when the first 5 to 10 minutes after the baby's born, there's a lot to worry about. You're assessing the mom, you're assessing the baby, you're checking for tears, you're waiting for the placenta, the baby's transitioning well, they're in the water, they need to get out, they're feeling lightheaded, dizzy, the baby's not doing well, the mom's bleeding. Like, it can be a little overwhelming that first 10-15 minutes after the baby comes out, but many times it's normal and low key and healthy and everything goes really well. But you definitely have to know your skills for handling postpartum hemorrhages and newborn resuscitations in that immediate postpartum. So, as an overall conclusion, midwives and their birth teams need to provide the skills, the assessment, the interventions, and support that are required for normal and complicated births, especially in that immediate postpartum period. Holistic care addresses physical, emotional, and psychological needs. You need to be monitoring the mom and baby simultaneously, very closely, the first hour, breastfeeding support, and timely intervention if something is going on. You really need to make sure that your midwifery model of care and the birth team all have a high quality safety, compassion, education, and empowerment aspect to their services.